Hi everyone. Today I'll be reflecting on how I could further improve my assessment through the health advancement and health promotion tender application. This project focused on designing a proposal for a mental health clinic at Western Sydney University to address the rising rates of mental health issues among students. My proposal including an executive summary needs assessment, project plan, evaluation framework and budget. While I scored while I scored highly for the strong structure, clarity, and relevance, I reflect on areas where I could strengthen it further, particularly in evidence integration, stakeholder engagement, data justification, and sustainability planning. I'll discuss this aspect in detail. Um, One of the first areas I could improve is depth and breadth of evidence used to justify the proposal. In my original submission, I included strong background information such as national mental health statistic and study by Downs on implementing a College of Mental Health program. However, the tender could have been stronger with a broader range of recent academic and policy referencing. The National Mental Health and Suicide Prevention Agreement, for example, it established in 2022, and the Australian University Mental Health Framework in 2021, and reports from Australian Institute of Health and Welfare on student well-being, including more localized data, for example, specific statistics on Western Sydney students' mental health outcomes or wait times for counselling would make the case more compelling. If I were to improve this assessment, I would include graphs or infographics showing the prevalence of anxiety, depression, and help seeking barriers among university students. This would strengthen the visual and analytical impact of their needs assessment, making the argument for funding even more persuasive. The project goal and objective in my original tender were very clear and measurable to establish a comprehensive mental health clinical accessibility to at least 80% of the students in the first year. However, I could improve by creating stronger connection between these objective key activities and expected outcome. For example, while I listed activities such as telehealth implementation, awareness campaigns, and multidisciplinary care, I could link each onto the specific performance indications such as increase in the number of students accessing mental health service by 30% within 12 months, reduction in average wait time for approximately to less than 2 weeks, or improvement in student satisfaction scores by 20%. By aligning activities with quantifiable outcomes, I could demonstrate clear accountability and measurable success, which are critical in tender applications. Strengthening stakeholder engagement. Another key area for improvement is stakeholder engagement. My original assessment mentioned collaboration with psychologists, social workers, and counselors, but I could extend the broader partnership. For example, collaborating with the student associations and peer support networks to co-design awareness campaigns, involving academic staff and tutors in clearly detection of mental distress among students, partnering with local health agencies and NGOs such as Headspacing or Lifeline to provide after hours or specialized services. Including a stakeholder engagement map would visually demonstrate who is involved, their roles, and how they contribute to the project. This program shows that the initiative isn't just a university service but a community integrated program aligning with real world health promotion models like Ottawa Charter's strengthening community actions. Next, come to the evaluation framework. Um, my evaluation section um, My evaluation section already included strong formative components such as testing material, delivery methods, provider types, and cost. However, I could improve this section by introducing summative and impact evaluation measures to show how success would be accessed over time. For example, I could include short-term in outcomes, increase student awareness of mental health services measured via surveys, medium term outcomes, improved mental well-being scores among service users measured by validated scales like DASS 21. Long term outcomes like decreased rates of academic withdrawal or failures related to mental health issues. Additionally, specifying data analysis methods such as using SPSS for survey analysis or um, analysis for quantitative feedback would demonstrate methodological rigor and align with postgraduate research expectation. Next, improving the budget justification, I could enhance it with a stronger justification of cost effective and sustainability. For example, I could break down the cost by purpose and expected impact, showing how each expenditure contribute to specific outcomes, including a cost benefit rationale such as how early intervention reduces long term healthcare costs would make the proposal more persuasive to funders. I could also add a sustainability plan explaining how the clinic would continue operating beyond the initial 3-year funding period, perhaps through government grants, insurance debates, rebates, or partnership with health organizations. This would show foresight and align the proposal with real world funding expectations. Um, my assessment outlined a general timeline with the initiation, planning, execution, and evaluation phases. To improve, I could make the timeline more detailed and visual. For example, by adding Gantt charts, this would display key milestones such as staff recruitment, clinic setup, awareness campaign launch, and evaluation checkpoints. A virtual timeline makes the complex project easier to interpret and demonstrate strong organizational and project management skill, both highly valued in tender applications. Incorporating behavioral change models. Another way to improve the theoretical foundation of my assessment is to explicitly link the proposal to health promotion framework and behavioral change theory. For instance, I could integrate believe model to explain how increasing knowledge and reducing stigma encourages students to seek help. The trans theoretical model stages of change to tailor interventions for students at different readiness levels, or the social ecological model to show how the initiative addresses multiple levels, individual, interpersonal, organizational, and policy. By embedding these theories, my proposal would show a strong academic foundation and demonstrate that interventions are grounded to evidence-based behavioral science. Um, Next comes the writing and visual appeal. Although my writing was clear and professional, I could enhance the presentation further for more polished and competitive trend. I could use infographics, icons, and flowcharts to visually summarize the complex sections. Add tables, charts to compare existing campus services with the proposed clinic service. Ensure consistency in formatting fonts, spacing, maintaining professional readability. I could also make the executive summary more concise and impactful, focusing on outcomes, innovations, and return on investment, since reviewers often judge tenders by the first page. Reflecting on this project, I'm proud of how it combined my background in health science and dentistry with the current public health training. However, to elevate it further, I could focus on integration, evidence, and sustainability. Specifically, I would strengthen the evidence base with updated data and frameworks, improve stakeholder engagement through partnership and co-design, expand the evaluation framework with measurable outcomes and analytical tools, justify the course more clearly by plan for the long-term sustainability, enhance presentation using visual and behavioral models. Overall, these improvement would transform the proposal from a this would transform the proposal from a strong academic project into a funding ready professional health promotion tender that could be realistically be implemented within the university setting. This reflective process has taught me how critical it is to go beyond the good writing to think strategically, design evidence-based program, and communicate with clarity and impact. Thank you.